Hi, I'm Dr. Linda Bradley. I'm passionate about seeing women with uterine fibroids and abnormal uterine bleeding. I'm currently director for the Center of Menstrual Disorders at the Cleveland Clinic in Cleveland, Ohio. So uterine fibroids are growth within the uterus. A normal uterus is about the size of a lemon, and these benign, rare cancerous cells, we call them fibroids or leiomyomas. These are growths within the muscle of the uterus, the outer wall of the uterus, or actually inside the space where a baby grows. Fibroids can grow and grow and grow till they get to be the size of an orange, a grapefruit, turkey, a basketball. So size, number, and location of the fibroids will determine the symptoms. Patients may have heavy bleeding, prolonged bleeding, bleeding after intercourse. You have your period and you stop, and then 2 weeks later you bleed again. Sometimes women will have bad menstrual cramps, difficulty getting pregnant, miscarriage, infertility, pain. And as the fibroid grows, it can stretch the uterus. When they get really big, sometimes it's like a pregnancy. You can look pregnant cosmetically. It can push on your bladder that makes you either go to the bathroom frequently, lose urine when you cough or sneeze, or sometimes you can't void at all. Some women get constipation if the fibroid is more on the back wall of the uterus. Never should your period be so problematic that you have to miss work or activities. You should never be socially embarrassed because you bleed through clothing, through your mattress. You shouldn't be taking extra set of clothing to work because you're going to bleed through things. You shouldn't have a craving for ice or iron deficiency or need blood or blood transfusions or IV infusions of iron. The days of the only treatment for fibroids being a hysterectomy are days long ago. If you're given that option, I would strongly advise that you get a second opinion with a physician. And if you need surgery, to make sure your physician is a high volume surgeon at a high volume center. The more we do as surgeons, the better we get. And so you want a physician that is highly trained in all the new technology. There's a new array of medications. They're called GnRH antagonists. What they do is lower the estrogen levels and stops the period. Also can decrease the size of the uterus. There are also some medicines called tranexamic acid or Lysteta, over the counter in other countries, but here is a prescription. It's not a hormone. You only use it during your menstrual cycles. There are some safeguards. You could not take it if you have had a blood clot in your legs or lungs or a heart attack or stroke. Another great medication is also under the category of antifibrinolytics, which decrease clotting, the amount of bleeding, even the duration of bleeding. Then we have progesterone IUDs. It's medicated with progesterone. It can go inside the uterus for contraception, but also it treats heavy bleeding. And right now we use it for up to 6 years and take it out if someone wants to get pregnant. And then the standby that we've had since the 1960s is low-dose birth control pills. If you need surgery, it really should be minimally invasive gynecologic surgery with small incisions the size of a thumbnail. If the fibroid is just in the space where a baby is, we use a hysteroscope. We go through the vagina to shave off or remove the fibroids. In women who don't want children, we may work collaboratively with our interventional radiologists. They can guide certain wires or catheters into the uterine artery in a 60-minute procedure, block the flow of blood to the fibroids, starving the fibroids so the size of the fibroids decreases, bleeding gets better, pressure gets better. One size doesn't fit all. So you'll need to tell your story to your healthcare provider and help to look at the algorithm, what works if you don't want to be pregnant, what works if you want to be pregnant, and then at some point, do you actually need surgery? And if so, what type? Rarely is a hysterectomy an emergency surgery. You have time to get opinions. My take home message to you today is that if you have symptoms, you should see a physician who can offer you the whole palette, the whole array of options for the treatment of fibroid related symptoms. Hysterectomy should never be your first choice.